Once upon a time, there was a patient who was referred to our hospital by his family doctor. At his first appointment, the patient was introduced to his doctor. As advised, he brought along his wife so she could listen in and ask questions. Because obviously, patients have a lot to take in. To begin, the doctor asked a lot of questions to be sure that the patient data was recorded correctly. The patient gave this data himself, which contributes to his own safety. At Maastricht UMC Plus, we take good care of patient data. From the first moment we meet and register a patient. We do this because our patients need to feel certain that their privacy is respected and that information is transferred correctly between his new doctor and earlier practitioners, such as the family doctor and pharmacist. We need to be 100% certain that we have the right person in front of us and that the information we have about him is correct. That is why we have the patient identification protocol. Everything has to be right. Name, medications used, citizen service number, examination, treatment, insurer. There is one single doctor who follows each patient's entire course, the head practitioner. Since there are usually various professionals involved in the treatment of a patient, it's important that someone sees the bigger picture. Patients should feel confident that they are receiving the right information at the right time about their specific treatment so that they can easily follow what is happening to them. The patient is examined further. Blood is drawn and X-rays are taken. Before the operation can begin, the hospital first has to turn him inside out, or so it seems. During all treatments and examinations, we check if we have the right person in front of us and if all the information in the system is correct. Patients are in good hands with us. Our staff wear hospital clothing during all examinations and treatments, and when needed, wear masks and gloves. This is to follow the rules of basic hygiene. We absolutely must prevent staff from transferring bacteria, viruses, and fungi from patient to patient in the hospital. That is why we wash our hands and disinfect them again and again. The patient goes from one hospital department to another and meets other doctors. Everyone questions him and reads his file again. So much administration, he thinks. They have their hands full. Every time a patient is transferred to another department, the treating doctors repeat the information on the checklist together. Treatment teams must communicate well among themselves during treatment and have a customer-oriented attitude. Moreover, our entire nursing staff is attentive because situations can change, and appropriate and quick responses are important. That not only applies to a patient situation, but also to other potential risks in our hospital. That's why we practice in a simulation center, so that we are as prepared as can be when necessary. This also ensures that we can function as an alert team under pressure. All unsafe situations and incidents that occur in daily life with patients and staff are recorded in the incident reporting system, so that we can learn from them and can improve things. The doctor records the medication he wants to prescribe in the electronic prescription system, EVS. The EVS contains a patient's total medication history so that the doctor knows what medication a patient is already taking and can prevent any unwanted drug combinations. Drug safety is high on our priority list. The preparation and administration of medication are always double-checked to ensure that only the right medicine is used in the right amounts. The medication for infusions is always prepared by the pharmacist's assistants in a calm environment, which dramatically reduces the number of medication errors. Before medication is administered, the identification bracelet is always scanned first. The patient has to recover in the hospital for a while. The nurses help to prevent the patient from developing bed sores. If the patient is bedridden for a long time, he will need special care and the use of a special bed and pillows. A clean bed is vital, and there must be as few creases and wrinkles in the bedding as possible to prevent bed sores. Drinking enough fluids, exercising, and changing positions also helps. Suggestions for preventing pressure ulcers comes from care and nursing professionals, like many other proposals for improvement. Our staff should not overburden themselves in any of their work. They know the ARBO policy of Maastricht UMC+. So long as the patient stays in the hospital, all sorts of data is saved about him. Examination results, blood pressure measurements, temperature and medication use, and also measurements of pain and malnourishment. Our patient knows by now that the identification bracelet on his wrist is not there for decoration purposes. Information about patients is therefore not stored on memory sticks, and digital information must be sent safely and only to the correct recipient. This is why we make sure that not just anybody can read along on a computer screen. A patient's environment influences his treatment and recovery. A safe and comfortable environment is therefore essential. Our hospital has made all kinds of provisions for situations that no one hopes will ever occur, but for which we still need to be prepared. Should such a situation arise, we'll call the emergency phone number 1000. For instance, when a patient or staff member suddenly becomes unwell, or in cases of fire, aggression, and suspicious and unsafe situations. And there you have it. The patient is ready to go home. During a final meeting with his doctor, he gets instructions to follow at home. The medication that he must continue to use is also discussed. All the data is updated in the computer, including insurance information. This ensures that an accurate insurance claim can be made. Finally, the doctor fills in the final details, such as the patient's discharge date and the date for his follow-up appointment. Everything is registered in the computer system again. And also, very important insurance claims can be processed. For this reason, accurate registration of patient data is important. Thus, we ensure that the hospital can be properly paid by the insurers for services rendered. Patients are vulnerable people. Working safely is therefore of the utmost importance at Maastricht UMC+. But a safe working environment is also important for our staff. We keep sensitive information secure, both on our computers and in our files. We keep a watchful eye on what goes on in this building, and finally, we watch over the hospital's money and property as if they were our own. High five for comprehensive risk management at Maastricht UMC+. High five! We care!